The National Health Research Conference is taking place this weekend, and joining us for a conversation and some updates is Dave Cassie, co-chair of the Interinstitutional Planning Committee National Health Research Conference, and Shenice Nyack, member of Marketing and Promotions Subcommittee, the National Health Research Conference. Good morning to both of you and welcome to the show.
Hi, good morning.
Good morning.
Good morning. Wonderful to have both of you with us this morning for, I would dare say, an intense conversation, because this conference is going to be taking place. Definitely is the beginning of some moving and shaking for healthcare in Trinidad and Tobago. So let's jump straight into the conversation this morning. Dave, if we could start with you, what is the main goal of the conference?
So the main goal of the conference is really to share research findings with some of the key stakeholders, those being health and health-related practitioners in Trinidad and Tobago. We're also trying to collaborate, create a culture of a research culture and a research community, and to help build research capacity within the institutions, as well as going forward to inform and to impact health policy and research.
Now, speaking about building a research community particularly, is this something that you would say we already are invested in Trinidad and Tobago, or is this something that we are growing with time?
I would say we are growing with the time, because for each of the partner institutions do have some framework within their institutions to build research. This conference is really providing that platform where all the stakeholders are coming together to pretty much share what is happening with health-related research in Trinidad and Tobago.
Now, one of the things that was mentioned by Dave is stakeholders. So Shenice, bringing you into the conversation now, who is this conference primarily targeted towards?
It's targeted towards all scientists, social workers, anyone really, because it's not just about science, it's not just about healthcare, it's about anyone. The core objective of this is to share our research findings in order to nurture junior researchers. So anyone who wants to get into research at any point in time or anything in academics, this would be good to attend, because it's not just about the research, you know? We love to collaborate. We love to share our health resources, our health and research culture and stuff like that.
Now, as you mentioned, it's not just about research, but we see, of course, the title of the conference is National Health Research Conference. So how are you going to be sharing this research information, particularly with participants? Dave, we'll go to you.
Okay, so over the course of this one-day conference, we will disseminate information via the oral presentations. There are about four segments of oral presentations spread along the day. And in addition as well, we do have poster presentations that will be visually displayed via electronic means, so that we have about 90 presentations in that format and about 16 oral presentations designated. I can just share with you as well a little bit about, let's say, in terms of the segments. I'll just give you the headlines in terms of what those oral presentations will be about. So the first segment will deal with COVID-19 and emerging diseases. The second segment will deal with chronic non-communicable diseases. The third segment will highlight clinical and laboratory studies. And then we round off the oral presentations with those that reflect mental health and dementia. So during the course of the entire day, presentations will be geared towards these general topics, as well as a broad range of topics will be put forward from our poster presentation.
How did your team how did your team choose, rather, these specific topics? I mean, we're hearing things, of course, like COVID-19 that's trending, mental health that's trending, but was there any specific criteria or perhaps statistics that needed to be observed before coming to a final decision as to what will be covered?
Well, we have in place our research subcommittee, which pretty much scientific research subcommittee, which would pretty much handle the criteria. But these segments would have been based on the after we have made a call for papers and the abstracts that were submitted. Have the committee, having looked at all the presentations, would have chosen those that could fit into these specific categories. And again, this is in keeping with our theme for this year's conference, Healthcare for the Future, Emerging Threats and Sustainable Solutions.
And that is such a beautiful theme. So, Shenice, we're going to come back to you because we're talking about healthcare for the future. And one of the things that we've seen noted with the National Health Research Conference is the participation of junior researchers, university staff, and so much more. So, how are they going to be a part of it? It's happening on the 17th, correct?
Yes. So, for example, when I went to the conference for the first time, that was last year, I was actually still a vet student. I'm graduated as a vet now. But when I was a vet student, my lecturer actually really encouraged us. He said, although it was a simple research project you all did and it's junior research, you all could take part. And we submitted an abstract. It was accepted. And we went to the conference and it was so amazing. Like, it was so captivating, everything about it. There was never a moment where I said, oh gosh, like this is so boring, or like I don't want to be here or anything. I was so excited throughout, and when it was coming to an end, I was like, oh my gosh, this is going so good. I didn't even realize how much time passed. And I am fully recommending anyone who is into research at all or wants to get into research, they should attend. It's really, really nice.
Shenice, would you say that that was a definitive moment for you in your career after you went to this conference?
Literally, it was, because now I am on the planning committee. So,
now, being on the planning committee, how long would you say it takes to bring everything together for this conference?
wow, months. It honestly takes months, because we have to start like months in advance in terms of calling for papers and calling for abstracts for people to submit. Then the scientific review committee has to go through it. We, as the promotions committee, we have to attain sponsorship. We have to have a budget, figure out everything in advance, book our venue in advance. So months. But Dave may have more information on like particulars as a co-chair.
Well, great, because I'm coming back to Dave for two things. So before we get to my second question, well, that we just shared with Shenice, Dave, share with us how long planning for something like this takes.
Well, it usually starts by about January or February of the year, because this conference is happening annually in November. So we would probably start usually around January, February of that year. And again, as Shenice would have highlighted, it would have take a lot of manpower in terms of, we would have had to divide the entire committee into subcommittees, and each responsible for like things like marketing and promotion, finance, the finance committee, of course, awards and prizes, logistics, and all that. So it does take a lot of time and energy. And of course, we are very happy that we can share this with Trinidad and Tobago. And we're looking forward as well to, even though our registration has closed because the interest has been very, very positive and overwhelming, we are already looking towards, we have already planned that we're going to have our conference in November 2022, the 22nd of November 2024. And of course, we're looking into the theme has already been chosen. It's relating to digital health transformation, leveraging technology for better healthcare. So even now, we've already began to prepare for 2024. So hence, it does take a lot of time and energy and effort. And I want to as well thank all our representatives from our partners at this time for being, up to the task and doing their best to bring it to this level that it has achieved thus far.
Incredible. I'm already looking forward to 2024 because that's such a critical conversation that we do need to have. And it's lovely that you're starting with the theme this year of, healthcare in the future and moving to digital, because that is something that we need to continue to have a conversation about. We also need to talk about who is going to be speaking at the National Health Research Conference, because if I'm not mistaken, you definitely have some esteemed speakers on the panel. Can you share with us, Shenice?
Yes. So we do have Dr. Wayne Frederick. He's our international guest speaker, and he will be having a great oral presentation on artificial intelligence in healthcare. And I think that is a very important topic that needs to be addressed. Also, we will be having our Lifetime Achievement Awardee, who is Professor Gerard Hutchinson. And other than that, I think Dr. Cassie may know if we have other recognized or well-known speakers.
Fantastic. And
yes, I believe sorry.
Go ahead.
I can
go ahead.
Yes, so I think Shenice touched on the two main speakers that we have. But during the opening ceremony, the Minister of Health will also be there, in addition to the president of UTT, the principal or the deputy principal of UWI, as well as the president of the University of Southern Caribbean. That's Dr. Colwick Wilson. And yeah, so we have in the opening ceremony part, we do have quite esteemed speakers from Trinidad, including as well, as I said, Dr. Mr. Terence Dialsing, our Minister of Health, to do some opening remarks as well. Yeah.
I definitely feel you with that one. I have said that more than once myself on national television, Mr. Terence Dialsing. So let's talk about how many people you're expecting at this conference, Dave. What would you say is your estimate?
Yeah. So we have catered for around 250 people. And pretty much we have had to close registration at that point. Yes.
Wow, that's quite a lot. And of course, this is your target audience. So we're talking about maybe lab specialists, RHA administrators, Ministry of Health representatives, students, and so much more. Now, one question that we definitely want to ask, of course, just going back to the theme for a quick moment, is how exactly would you say that your teams and all reps are going to be able to actually address the moving forward of healthcare, and particularly healthcare challenges and solutions? Is this something that perhaps you're going to be teaming up in groups and talking about, or is this something that's already been worked on and is going to be presented on the day itself?
So let me just say that, again, when having such a platform like this, we bring forth research that is related to the theme to some extent. And again, providing information at that point is the first step in, let's say, impacting some kind of policy going forward. I would even go back to when the conference was held virtually for the first time in 2020. A lot of the research studies in there had to deal with vaccine hesitancy, and that was the height of the COVID pandemic. So the information there that was presented would have informed certain policy decisions when it came to how to treat with vaccine hesitancy, let's say in Trinidad and Tobago. So within the conference, you will have speakers that will speak to some of the current threats that they see. And again, in terms of advising of solutions, yes, that is where, again, discussion will take place. And there can be that kind of engagement and collaboration that it could come forward with plausible solutions for the future.
Absolutely wonderful. Now, what about the inclusion of the general public? Is that something that also is an option for this conference, or is it closed? Shenice?
Well, the conference right now, the registration is closed in that regard, but it is open. It has been opened for over a month or so, where members of the public who are interested in research could have become part of this, because I believe they are a key stakeholder in understanding what is taking place within our institutions as regard health research, and of course, getting more in tune with because they'll get a sense of what is going on. It will inform eventually what we do as a country as it relates to health research.
Wonderful. Thank you so much for that, Dave. Shenice, I would like to bring you back into the conversation, because you can see the eagerness, the excitement as you spoke about your first experience. What would you say to the young researchers who are interested but possibly a bit hesitant about this health research conference that's taking place on Friday?
Okay, well, I would say it depends on why you're hesitant. If you're hesitant because you feel as though the information that they are presenting on won't speak to you in some way, honestly, you never know. Because, like, for example, a lot of topics last year were focused on antimicrobial resistance. And some people might say, oh, well, what does that have to do with me? Or how will that affect me? But when you really think about it, it affects all of us. It affects all of our healthcare systems and how the risk of us contracting diseases and not being able to treat them. So, I mean, I think it depends on the reason of hesitancy. If they feel as though it's scary to go, and like they maybe might not fit in because they are bigger, more senior researchers there, whereas they are junior researchers. No, it's not that way at all. It's so inclusive. It's so collaborative. Everyone networks with each other. Everyone is so friendly and welcoming. So yeah, I would say give it a try. Don't be afraid. Don't be, hesitant about something like this. It's really an amazing experience. And I'm not just saying that because I attended and I'm attending this year. I'm saying that because I was a vet student for the past 5 years, and I've never experienced something so uplifting. Research is so uplifting, and it motivates me, honestly.
We can definitely see that motivation and the keen interest as well. So Dave, Cassie, and Shenice Nyack, thank you so much for joining us this morning. It has been a pleasure. Looking forward to having you back on the show to talk about 2024 as well, because that theme has already piqued our interest, and wishing you all the best on Friday the 17th at your conference. Have a great day.
Thank you.
Dave, Cassie, and Shenice Nyack talking about the upcoming National Health Research Conference taking place at the Hyatt on the 17th of November. That's this Friday. Stay tuned. There's a lot more taking place in Trinidad and Tobago that you want to know about, and we'll be sharing it with you when we come back.
How you tell me who's this? Calling you at 2:46 in the morning, saying that she wants it. Don't tell me it's work related.